Diabetes on a simple level means your blood sugar is elevated. Diagnosis of diabetes can be based on one of the following criteria: a fasting blood sugar greater than 126, a blood sugar greater than 200 on a 75-gram carb ingestion, or hemoglobin A1C greater than 6.5. What are the problems that can happen with an elevated blood sugar? Well, if your blood sugar is really high, there can be dehydration. Your kidneys can't keep enough of the blood sugar in your blood, and it starts to spill into the kidneys. That draws more fluid into the kidneys and into the bladder, causing you to get dehydrated. Along with that, many of the electrolytes, potassium, magnesium, and others may start to be washed away through the body, and people can start to get dehydrated. When they get dehydrated, they can become thirsty. There are two types of diabetes. One type of diabetes is type 1 diabetes, which means there is no insulin. Insulin, think of that as a key that opens a door. The key to the door is to the cells in our body, in our liver and our muscle, that's use and store glucose into a storage form called glycogen. Well, that key isn't being made, and eventually in type 1 diabetes there is none of the insulin, none of the protein left, and the blood sugars rise. Insulin replaces the loss of that, and blood sugars can normalize. With the more common type of diabetes, especially in adults, but unfortunately as common in kids now as type 1 diabetes, is what we call type 2 diabetes, or adult onset diabetes. And again, that's unfortunately already occurring in children. With type 2 diabetes, the body is actually initially making a lot more insulin. In the beginning stages of type 2 diabetes, somebody may have a completely normal blood sugar, but they're having to make higher levels of insulin in order to get the blood sugar down. Over time, this level will not be able to keep up, and the insulin doesn't work as well. One of the ways to look at it is, because of something called insulin resistance, the insulin is not able to open the door, unlock the door. The locking mechanism has been gummed up, and it's harder to open, so your body has to make more and more insulin. It doesn't work as well, and the levels start to rise. Over time, the insulin levels may actually start to drop. What causes this in type 2 diabetes is getting better understood, but we think there has a lot to do with increased levels of fats, especially in our mitochondria, in our liver cells, and those that are packaging energy, cells that help manage and package our energy, the energy in our body. What happens when we have excess fat in the form of our diet, as well as that what's stored in our body, there's higher levels of this saturated fat. In a sense, that gums up so that the insulin doesn't work as well, so that insulin and the cells that take in insulin aren't allowing glucose to enter the cells, and this can then lead to elevated blood sugars. By eating a whole foods plant-based diet, as shown in this study from 2009, vegans had a much lower BMI than non-vegans. Also, the risk of diabetes was about a third less in vegans. More amount of fat ungums up this process that even within days of making a change to a whole foods plant-based diet, blood sugars can make a significant drop and can persist over time until somebody gets down to their ideal body weight. This can vary. The level of insulin resistance can vary. Part of this is genetic. So somebody may have an extra 20 pounds at age 50 and have insulin resistance, where another person may need 40 extra pounds to get the same level of insulin resistance. But for most people, when they get to their lean ideal body weight, the insulin resistance goes away. There can, if it persists despite that, we have to wonder if there may be already some loss of insulin being produced in the body and more of a type 1 diabetes. As we can see from the graph here, as body mass index goes up, as weight goes up, the risk of diabetes goes up, but this does vary among people groups as shown here. As body mass index goes over 25, the risk of diabetes goes up significantly. What are the complications of diabetes? Unfortunately, a large percentage of people with diabetes don't have any symptoms. In fact, for many, they first find out they have diabetes when they have their first heart attack or stroke. Well, I talked earlier about the dehydration and the short-term problems of getting dehydrated and thirsty, and electrolyte problems, low potassium levels. If we're talking in type 2 diabetes initially, if it's very high, there can be blurry vision. There can sometimes be weight loss initially because the levels of insulin are not working and there's not enough and they aren't working, and the body can't store glucose and it's wasted, and the body starts burning down muscle in order to compensate. There are other problems we categorize, medically speaking, as microvascular problems. Those are problems to the nerves. Glucose attached to the proteins of the nerves can cause problems with numbness. That's why we like to check every 6 months somebody's foot exam to make sure they don't have any numbness. If you develop numbness, you can not notice that you may have a callus or a sore that can lead to an infection. High glucose levels over time can also lead to blindness. That is because there can be growth and extra growth of blood cells in the back of the eye called the retina. That's why we recommend getting an eye exam every year, because if we do detect that, that can be treated with surgery or laser type surgery to help abort that, to help prevent the blindness. Glucose attaching to the proteins of the kidneys can cause injury to the kidneys and causing protein to leak in the urine. There's a test called the urine microalbumin. It detects a small amount of this protein called albumin that's supposed to only be in the blood, but if we detect some of that in the urine, that's cause for concern. Microvascular problems that we just talked about, those don't usually kill people. People don't usually die of numbness or blindness. What people do die from is what we call macrovascular disease. That is basically heart disease, heart attacks, bypass surgery, as well as strokes. When it comes to the importance in controlling and reversing or preventing these, blood sugar control is very important in preventing microvascular disease, the blindness, the kidney problems, and numbness, improving immune function control. Unfortunately, it has not been very strong as far as preventing heart attacks and strokes. When it comes to the importance of those, lowering blood pressure and keeping your blood pressure under ideal control, at a minimum having blood pressure systolically less than 40 and less than 90, and probably less than 130 or less than 80, although some recent studies haven't been as clear whether that extra benefit of treating your blood pressure to a lower level will be helpful. We've learned in observational studies that those who have lower blood pressures actually have lower risk of heart disease, but we haven't proven when we get down to the less than 135 level if that actually reverses heart disease. The other importance is getting the cholesterol down. Because of the plaque buildup with diabetes, and because people who have diabetes are at the same risk of having a heart attack as somebody who's already had a heart attack. And if you look at other risk factors, diabetes with high blood pressure or smoking, the risk is actually even higher in somebody who's never had a heart attack but has diabetes or another major health problem like hypertension or smoking than somebody who's already had a heart attack. LDL goals are less than 70, with ApoB less than 80, and LDL particle less than 1,000, with less stringent goals if there are no risk factors such as smoking, high blood pressure, or family history along with diabetes. The only diet that's ever been proven to reverse plaque in the arteries is a whole foods plant-based diet. When we look at rates of diabetes, the rates of diabetes are the lowest in those who eat a whole foods plant-based diet compared to those who eat a typical American diet. We also look at average weights. Those weights of a whole foods plant-based vegan type diet are on average below the body mass index of 25 compared to a typical Western diet closer to 29 as demonstrated here. And we know that lower body weight does also seem to be connected with lowered risk of developing diabetes, or if you have diabetes, lowering your diabetes. We also know that when a hemoglobin A1C level gets above 5, the risk of heart disease and stroke goes up. This is similar to a fasting blood sugar of around 90. So when I have patients who come in and their blood sugar is between 90 and 100, or the A1C is greater than 5, I'm warning them that they need to make some lifestyle changes to help prevent the development of diabetes. Lifestyle changes were shown in those at risk for diabetes of lowering the development of diabetes by 58%. In this study from UCLA, 71% of those who were on an intensive diet and exercise program were able to get off pills for diabetes, and 39% of those who were on insulin were able to get off insulin. 34% of those taking blood pressure pills were able to get off of their blood pressure medication. Dr. Neil Barnard did a randomized controlled trial in diabetic patients and put them on either the American Diabetic Association diet or a whole foods low-fat plant-based diet, and there was a markedly lower blood sugar level in those who are on the whole foods plant-based diet, as well as lowering blood cholesterol levels, as well as weight, as well as increased patient satisfaction on a whole foods plant-based diet compared to the American Diabetic Association diet.